Hello, I'm Tim Fletcher, orthopaedic surgeon and member of the team here at Bunbury and Busselton Hospital, providing an orthopaedic service to the patients in the southwest. This video is one part of your information journey that will provide tips and insights in how to be well prepared for your operation, for what to expect when you come into hospital and when you're safely discharged home.
So hip and knee replacement is one of the most successful healthcare interventions in history. Over 100,000 hip and knee replacements are carried out in Australia each year now, and it's got a very reliable outcome with 90 to 95% of patients having a very happy outcome. The risk of complications is generally less than 5%, although this does vary from individual to individual. If your surgeon is talking about carrying out a hip or knee replacement, it generally means you have a severely arthritic joint with bone-on-bone changes on X-ray. It means you're having significant pain that requires painkillers, and you have significant disability affecting your activities of daily living and your mobility. Generally, you'll be placed on a wait list for surgery, and during the workup to surgery, a series of investigations will be carried out, including bloods, X-rays, a full nursing assessment and an anaesthetic assessment. It's worthwhile seeing a physio to organise some prehab to keep the joint mobile and strong, and you should keep your skin in good condition, as any problems with that can increase the risk of infection. On the day of surgery, you'll be admitted to the hospital, and most people stay in hospital for between 1 and 3 days after surgery. You'll be looked after by a team of doctors, physios and nurses, and you won't be discharged from hospital until your pain is well controlled, you're safely mobile and you're ready to cope at home. The first week or two is generally quite tough going, especially for the knees, but by 6 weeks most people are going well. The hips are doing better than the knees at 6 weeks, but by 3 months there's not much in it. And certainly by 12 months, most people have made a full recovery and are going very well. If people are working, they generally return to physical roles at about 3 months post-surgery, but lighter office-type roles can commence at 6 or even 8 weeks, and driving can commence on the right side at 6 weeks and on the left side at 4 weeks if the car is an automatic car. Patients often ask, how long will the joint last? 95% of hips and knees last more than 10 years in the Australian Joint Registry, and I think in a modern hip or knee replacement, one of the gold standard joints can be expected to last 20 years plus, unless you're very unlucky.
Before you begin your operation journey, it is important that you have an up-to-date list of your medications, including details about when you stopped, started or changed any medications. This also includes any over-the-counter medication you may be taking. Before your admission, you should also avoid cuts and scratches and arrange to speak with your GP as to when to stop blood-thinning medications if you use it.
When you come to see the pre-admission nurse, it is essential that you bring all regular medications that you're on, including vitamins and minerals. It is also essential that you inform us of all your medical history. When seeing the nurse, it is important that you bring your usual medications, including over-the-counter medications like vitamins, and a copy of your medical history. You will also require your MRSA screening, your midstream urine sample, and any blood tests. You will be provided with some Chlorhex wash, which you are required to use the day of your surgery before you come to hospital.
Let's go through some exercises that you can do before your surgery. Hi John, I'm going to show you some really simple exercises that are quite safe to do while you're waiting for your surgery, just to get those muscles going. So on your strong leg, if you can just gently come forwards and straighten all the way up and really tense that thigh muscle. Yeah, feel that?
Yeah, just a bit, yeah.
Good, and come down. And if the knee's a bit stiff, just bend under. Yep. And do it once more for me, because this muscle's really good for walking. Good, all the way out. Yep. Great.
Down there.
And coming back in. Now obviously that would be a little bit more difficult after the operation.
Yes, sure.
So this is the leg you've had the operation on. So go a little bit slower for me, and I want you to just more get the movement.
Okay,
so slowly straighten. You can keep your heel down. Beautiful. Don't have to lift it if it's too sore. And then slowly bend under. Be nice to that knee.
Go back as far as I can.
Yep.
Just about there.
Just till it pulls, yep.
Again?
Yep, just one more for me, all the way out. Keep the heel down. Gently straighten.
No.
And then sliding under nice and slowly. Right.
Yeah.
It's a lot easier with the support of the floor for after the operation. Yep. Another one that's really good to do before the operation for these muscles as well, a lot of the leg muscles, is sitting to standing and back down. You might need to change the height of your chair. That might be a bit too low for you. So when you're doing these, choose the right height chair so it's not too hard but you're working. So just first of all use the arms and come up to standing for me. And then tense those muscles nice and tall, good. Nice and slowly back down now. Have a go, see how you go. So some people might find they have to use 1 or 2 hands. Not using the hands is a lot harder. So have one more go for me just without the hands and see how you go.
Straight up.
Yep. Yeah, so that was almost too low, that chair for you. That was great,
Yeah,
excellent.
Okay, down.
No, I think I'll show you the next one.
Okay.
So at the bench, so make sure you're somewhere safe, either one hand on, or if you're unsteady, 2 hands on the bench or the sink or something like that. And nice big powerful muscles going straight up and straight down. Try not to lean on the bench or do push-ups. This is for your balance.
support.
Yep, up and down. Lovely big powerful muscles, great for circulation, great for balance, great for walking. Good. Feel that?
Yeah, I can feel it, yes.
Great. But even with a really sore joint, whether it's your hip or knee, most people can tolerate those exercises, just simple ones. Sorry, we couldn't find a normal bed, John, so we had to use a hospital bed. But this is another exercise that a lot of people can manage before the operation and later on after the operation down the track a bit. So if you bend both knees up steady, one at a time, all the way up, and then the other one. And from there, you can start with your hands on the bed. Can you lift your hips off the bed? Good. You don't have to go so high and then down that don't have any pain with it. Look after your back. But you can feel those big muscles working and come up again. Just be careful you don't get a cramp in the hamstrings and then come down slowly. But very good for being able to move around the bed and help those walking muscles. Great. So if we can get you moving better and feeling more confident about exercising before your surgery, you're starting at a much higher baseline. You're still needing that joint replacement, we know that, and there is some recovery that has to go on with that. And that healing phase is no different for everyone. It takes time. So in that recovery though, you're already going to get back to a higher baseline much quicker than someone who isn't as strong and fit. The key to your recovery is continuing your exercises and walking regularly, as we recommend, with appropriate painkillers to help. So when you're ready to go home from hospital, we'll do a referral to your local physiotherapy service so that we can hand over how you were at the time you went home, and then they will follow you up in the next 1 to 2 weeks, depending on their caseload and their priorities.
As an occupational therapist, our goal is to help you manage after your surgery at home safely and independently. Initially, you may have some precautions or limitations, and we will help you to continue the things you need to do at home. These may include getting in and out of bed, on and off a chair, in and out the shower, dressing yourself, travelling in the car, and completing all your home duties such as cooking and cleaning. Prior to your surgery, you will be asked to attend a pre-operative appointment at your local health site. This is an appointment with an occupational therapist, a physiotherapist, and a continence nurse. It is important you come to this pre-operative appointment so we can review your individual home setup and you can collect any equipment you may need and learn how to use it safely. Please make sure you have planned where you will stay after your hospital admission. Are you staying with friends, in your own home, or in another town? Who will pick you up from hospital, or do you need help to book a taxi to take you home? Daily tasks we need you to consider prior to your surgery include meals. Think about freezing bulk meals. Cleaning, ensuring this is completed before you come into surgery. Shopping, ask friends or family or make use of home delivery services. And organisation of spaces, frequently accessed items at easy to reach heights. You will need to think about the height of your bed and chairs at home so that you can be comfortable and able to get up and down on your own after surgery. If your chairs are not suitable, the hospital will loan you one. Being able to safely and comfortably get on and off the toilet and have a shower is important after your surgery. We highly encourage you to loan the equipment to be able to aid in your recovery, such as shower chair or shower stools and over toilet frames. These help to raise the height to make getting up easier. So following your surgery, you may find bending or reaching uncomfortable, or you may not be able to do it due to your precautions. We have some long-handled aids you might find useful, such as a dressing stick, a long-handled shoehorn, or a long-handled reacher. All of these will be discussed with you in your pre-op appointment. You will not be allowed to drive immediately after your surgery. Your surgeon will tell you when you can return to driving, so please think about how you will get to appointments and around. Transferring in and out of the car after surgery may be a challenge. Learning the correct technique will make this easier. Max will demonstrate how. The first step is to make sure the seat is set up correctly. Push the whole seat back as far as it can go, then recline the backrest. If you have had a hip replacement, you will also need to make sure that your wedge cushion is placed on the seat, and a plastic bag on top of the foam will help you sit and swing into the car easier. Has had a knee replacement and will demonstrate how to transfer into the car safely. Standing up from the chair. And then walk over to the seat, Max, so your legs are felt behind the seat. And lowering yourself onto the seat and then twisting away into the car. Following surgery, some patients may experience post-op confusion. This can be caused by a number of different things, including the type of anaesthetic, pain relief, or how hydrated you are. If this has ever happened to you previously, it's very important that you tell staff, particularly if you have any other underlying cognitive or memory problems. If you are having your hip replaced, there may be precautions that you need to follow after your surgery to avoid dislocation of the new joint. Your surgeon will tell you if these apply to you and for how long you might need to use these precautions. These include not twisting at the hip, do not bend your hip past 90 degrees. When sitting, ensure your hips are above knee height, and when standing, avoid reaching forwards. Do not cross your legs in sitting or standing, and when laying, support your leg with a pillow so it doesn't fall across your midline.
As part of your joint replacement, you'll be required to see an anaesthetist and have a chat to them about your journey. As part of that, you'll need to go to your pre-op anaesthetic appointment where your anaesthetist will ask you questions about your general medical health. It's really important that you bring your medications with you. If you don't have the actual medications, just the prescriptions will be fine. Please be honest with your anaesthetist about any of your medical problems. There's nothing you can't tell us. We've generally heard it all. You may also require some further testing, and your anaesthetist will discuss this with you. One important thing that is often not remembered by patients is the fact that sleep apnea is a medical condition that when well treated isn't a problem, but it's important to mention this to your anaesthetist. So your anaesthetist will discuss with you the different types of anaesthetic that we use and what's appropriate for you. In general, most anaesthetics for a joint replacement is done under a spinal anaesthetic. This is very safe. There's a minimum amount of discomfort with it. We will talk you through the whole procedure, and you'll also be generally sedated at the time, so may not even remember any of it. As part of your anaesthetic, we may also use regional anaesthesia. That's essentially a situation where we numb a certain part of your body. We generally only use these for knee replacements, and what's involved in that is where we use our ultrasound to find the nerves that supply sensation to the joint and inject local anaesthetic around that nerve. We also, in certain situations, can feed a little tiny plastic tube in called a catheter, and that will sit there for up to 2 or 3 days after the operation and deliver local anaesthetic to the nerve, making it numb and reducing how much strong painkillers you need to have. With the anaesthetic itself, when you're in the operating theatre, the anaesthetist will be there keeping you comfortable. We generally have people either sedated or completely asleep under a general anaesthetic, but your anaesthetist will talk to you about that. After your operation, your anaesthetist will be helping you with dealing with your pain and any side effects from the pain medication or the anaesthetic. Some of the things to be aware of after an operation like this is that it can be very painful. In general, a knee replacement is more painful than a hip replacement, but everyone behaves differently after these operations. We will go through all of your medications prior to discharge to make sure that you're aware of what we're sending you home with and why we're doing that. Nausea and vomiting is unfortunately quite common after an anaesthetic and after joint replacement surgery, and there's multiple reasons for that. We will help get you through that process and deal with any of those complications. Confusion after an anaesthetic can be a particular problem, and for that reason your anaesthetist will tailor your anaesthetic to you to make sure they reduce your risk of confusion or delirium after an operation, and they will talk to you about that at your pre-anaesthetic consultation. It's not uncommon after major joint surgery, being on multiple medications, to feel a bit dizzy, lightheaded, a little bit hazy, that sort of thing, a bit drowsy. In general, if it's just making you feel like you're not quite yourself, then that's actually fine. It's more if there's a risk that you're going to fall over when you stand up. Also, after any operation, there is a risk of developing some medical complication, and the anaesthetists and the medical doctors will help look after you from that point of view. So you'll be reviewed daily after your operation by the acute pain service. They'll be asking you about your pain and any side effects from the pain treatment. Throughout your stay, the nurses and the acute pain service will ask you to score your pain from 0 to 10, with 0 being no pain and 10 being the worst imaginable pain. It will also ask you to score that pain when you move. It's important to ask for pain relief if you need it. No one can read your mind, so it's really important that you ask for pain relief, and especially if you're finding that you're comfortable when you're in bed and have no pain, we still need you to be able to move. So if you can't move when you're in bed, make sure you ask for some pain relief. The other thing you can ask for is some ice, and the nurses will provide you with ice to ice the joint. In addition to that, you will find that pain will be greater whenever you're doing your physiotherapy or moving, so make sure you ask for painkillers before you get up and do your physiotherapy. Your anaesthetist and the acute pain service are here to look after you and make you comfortable during your stay, so we hope you have a good sleep.
Before your surgery, you'll be booked in to see a continence nurse. During this interview, we will talk to you about your normal bladder and bowel habits and any previous medical and surgical history. This is a good opportunity to problem solve any problems before surgery. As part of this assessment, a urine test is taken to test for infection. A bladder ultrasound is used to check if your bladder is empty after urinating. If any concerns, your nurse will recommend a medical review. Before undergoing surgery and under anaesthetic, a catheter tube is inserted into your bladder. as spinal anaesthetic and painkillers can disrupt ability to go to the toilet. Once catheter is removed, you'll be assisted to use the patient toilet or a urinal. Remember to tell your nurse when you have visited the toilet. As part of recovery, your normal bowel habits may change. This is due to anaesthetic, pain relief and limited exercise. It is expected that you will move your bowels 24 to 48 hours after surgery. Once you are at home, drink plenty of fluids, fibre, fruits and vegetables, and keep moving, and take a stool softener if required. It is recommended that you drink at least 1.5 litres a day for good kidney function. Please contact your continence nurse or GP after surgery if you're experiencing any urinary frequency, urinary urgency or constipation.
In the days leading up to surgery, you should prepare your home to make sure it is safe on your return. Look for potential fall or trip hazards like rugs, cords and clutter. Move things to accessible positions and have any equipment ready for use. You may want to arrange some help with cleaning and meals. You won't be able to drive for approximately 4 to 6 weeks after your surgery, depending on the site of the operation and whether your vehicle is automatic or manual. So, plan for home delivery of shopping and set up online bill paying, or make arrangements for someone to look after this for you.
The day before your surgery, you will be called by the hospital to tell you what time you should arrive and where to go. They will tell you when to fast, stop eating food, and when to stop drinking and smoking. Tell your surgeon if you have any changes in your health, such as a sore throat, cold, fever, dental problem, bladder problem, or any skin conditions. Any of these may require your surgery to be changed for a later date. If you have diabetes and take medicine, ask the nurse or doctor who is managing your diabetes if you should take your medicine before surgery. You should have also packed a bag for your stay, but leave your valuables at home. You should bring clothes that are stretchy and comfortable, non-slip footwear, medications, mobile phone and headphones if you have them, and your sleep apnea machine if you use one at home. On the day of your surgery, before you come to hospital, you must use the pre-operative wash as instructed and provided by the nurse, as this helps to stop infection. When you arrive at hospital, you will be greeted by the volunteers. They will assist you with your COVID check-in and then will direct you to the day surgery unit at the hospital you are attending. The day surgery staff will then look after you. Waiting is normal, so we suggest you bring a book, magazine or similar to fill in the time. While you are at the hospital, there are some important things to remember. Bunbury and Busselton hospitals are non-smoking. Ask your GP regarding nicotine patches if unable to quit prior to surgery. Visiting hours may vary at each hospital. Please ask when you arrive. Hospital phones are only for incoming calls. We suggest you leave your valuables at home. After your operation, you may be in a mixed male-female 2 or 4 bed room, so expect some noise from neighbours. When in hospital, please tell us if you are worried about a recent change in your condition or a person you care for, and the healthcare team has not responded to your concerns. Call and respond early. Care is available to you and your visitors. You can call 1800 744 059.
It is important you set realistic goals for yourself after surgery and be familiar with what the procedures are after your operation. You will still have an intravenous fluid strip attached, and you may have a tube in your bladder. You will have either short tubes in your nose called nasal prongs or a mask for oxygen, and calf pumps to help stop blood clots.
We will be checking your heart rate and your blood pressure and regularly checking your pain scores.
It is normal to still have some numbness from the spinal anaesthetic. If you have had a knee replacement, you may also have a pump to help manage the pain. And if you feel up to it, you can have something to eat.
The day after surgery, you will be required to have further x-rays and blood tests. The physiotherapist will show you how to get in and out of bed and how to move around using a walking aid. We encourage you to have a shower and sit out of bed for all meals, as per your normal routine at home. You will have exercises to complete independently to keep the joint moving regularly. Hip and knee replacements are painful procedures. You will be asked daily what your pain level is. It is important to ask for pain relief sooner rather than later, if required. You will have a medication script on discharge to manage the pain along with instructions on how to use. It is important that you take medications as prescribed. Generally, regular medications remain unchanged on discharge unless there is a specific reason to change them.
Surgery.
New medications are usually limited to appropriate quantities of pain relievers, a course of preferred blood-thinning medication to prevent clots called deep vein thrombosis, products to help with going to the toilet.
After the operation, it is common to experience a varying level of discomfort, pain, swelling and redness around your wound. We will discharge you with painkillers to take at home that are important to take when needed and then to wean as your pain becomes less. Ice therapy can be an excellent addition to help manage your pain. It is common to suffer side effects from these medications and therefore very important to take daily laxatives until your regular bowel habit returns. Swelling in the operated limb can also be significant, so regular elevation of the affected limb is required. You will also be prescribed a daily blood thinner to help reduce the risk of blood clots. Regular gentle activity around your home or garden will also be beneficial for you. Depending on your surgeon's preference, you will be discharged with a watertight dressing or a strip of waterproof glue on your wound. This can be left intact until directed by your surgeon. We will follow you up in our clinics in the post-operative period, but if between these visits you have concerns regarding feeling unwell or difficulties with your wound, please contact your surgeon or your local GP.
I had a knee replacement 4 months ago on my left knee, and it's going well. Preparation at home, I cooked meals like pastas and soups and stocked the freezer prior to coming into hospital, and also I organised the equipment from the hospital here, like overhead toilet frame, shower chair, high back chair, footrest to make making me comfortable at home. The exercise I did prior to the operation were cycling, which is good for the muscle build up. Foot raises, a little bit of gym work, leg raises with light weights, squats, calf raises, just to strengthen those muscles prior to the operation. The information prior to the operation was a seminar here at the hospital, probably 4 or 5 weeks before the operation. One of the nuns, the senior nurses and physios came in to discuss what the operation was, what was going to happen, how would you cope, the pain level, and the occupational therapist also came in as well to discuss equipment that you did use that would help you and assist you when we're on the road to recovery from your hospital, from your operation. In the early days, I had a lot of sleepless nights because I thought the pin in the work was going to dislodge. So that was my biggest fear, that I was up all most of the night making sure my leg was in its correct position. Listen to your body, ask questions, talk to people who have had the operation as well. Talk to nurses or doctors. If you have any questions, your GP, nurses are always good people to go to. But I found that I had already known people have had the operation prior to me going in, and I just sat down and talked to them and to what their expectations were and how their recovery rate was. As far as the surgery met my expectations, yes, it did. For the people that are having the operation soon, I would recommend that they keep up with their pain medication, they rest, they listen to their doctors, nurses and professionals. The 3 key points would be ask questions, be prepared and know there is support.
Once given the all clear from your physio, OT, pain service and the medical team, you will be allowed to go home. Remember, you will not be able to drive and will need someone to pick you up. You will be referred for a follow-up physiotherapy appointment around 2 weeks after discharge to review your progress. The key to your recovery is continuing your exercises and walking regularly as recommended by your physiotherapist, with appropriate analgesia to assist.
We all work together to achieve the best outcome for you. Thanks for watching this video. We hope you have found it useful.